You're listening to a special edition from Dr. Angelo Gousse, who's a board-certified urologist specializing in urinary incontinence, pelvic floor reconstruction, treatment of bladder control problems in men and women. Many times you've heard the term urinary incontinence. In essence, what urinary incontinence really means is involuntary loss of urine from the bladder. There are several types of urinary incontinence. One of the most common type of urinary incontinence is called urge urinary incontinence, meaning you feel you got to rush to go to the bathroom and the urine escapes from your body before you get there or before you get fully undressed. And urine actually leaks out of your body, of your urethra. The second type of urinary incontinence is when you cough or sneeze or during activity, urine escapes only during the period of activity. This form of incontinence is called stress urinary incontinence. There are other less common types, such as overflow urinary incontinence, meaning when your bladder is too full and you actually urinate on yourself. And occasionally, you will find patients who have both. They have stress and urge urinary incontinence. Many individuals, male and female, can be affected by urinary incontinence, which means involuntary loss of urine, and they get wet, and it absolutely affects the quality of life. Unfortunately, often, the individual has to cope with the involuntary urinary leakage by wearing pads or diapers or papers, and often they feel embarrassed and they modify their daily activities because of the urinary incontinence. It might even interfere with interpersonal relationships. Many times we hear of urinary incontinence in women, but not too often do we hear of urinary incontinence in men. Particularly stress urinary incontinence in men, which means that men who develop involuntary leakage of urine during activity, doing effort, or just by merely standing up, they develop urinary incontinence and involuntary loss of urine. In most cases of stress urinary incontinence in male patients, it's because of treatment associated with prostate cancer. Most notably, removal of the prostate for cancer of the prostate can lead to involuntary loss of urine postoperatively. Often, the stress urinary incontinence after prostate surgery or treatment is transient. It's important to note that the urinary incontinence can develop not only after prostate removal for prostate cancer, but can also occur after radiation treatment for prostate cancer. Also of great importance, many men who have undergone radiation develop blockage at the level of the bladder neck and then subsequently need treatment leading to involuntary loss of urine. Therefore, both radiation treatment and removal of the prostate can lead to urinary incontinence. There are two major forms of treatment for sphincteric incontinence. When the sphincter of the male cannot hold the urine, one is called a male sling, where a hammock is placed underneath of the urethra to try to hold the urine. And the second is the gold standard, which is implant of the artificial urinary sphincter. At this institute, we specialize in implantation of the artificial urinary sphincter. I will show you exactly what the urinary sphincter entails. The artificial urinary sphincter has been around since 1972. It is considered the gold standard treatment for the management of post-prostate cancer treatment urinary incontinence. This gold standard device is implanted fully in the body. It has three major components. The first component is the actual cuff. The cuff looks like a blood pressure cuff, which is placed around the urethra. If you imagine the black component is the urethra where the urine escapes, the cuff is wrapped surgically around the urethra after it is dissected in order to compress the urethra, not allowing urine to escape from the urethra or the body. However, this cuff can be released at will when the patient has a need to urinate. The patient maintains the normal desire to urinate, and when the patient wants to urinate, the second component, which is a pump, is placed adjacent near the testicle. Upon pressing on the pump, the cuff is released and there is flow of urine coming from the urinary bladder, which is located here. It flows through the urethra and drains the urinary bladder. Without pressing the button for a second time, the cuff is then repressurized and pressure is applied around the urethra and therefore giving the opportunity for the bladder to refill itself. The third component, which is the pressure regulating balloon, transmits pressure to the urethra, occluding the urethra. We will discuss further some important elements of the artificial urinary sphincter after this break.